So in our post-lunch session, we will welcome now Dr. Marisa Nimrod, and she will share with us on the topic cancer and herbal remedies, cure or complications. I am very well assured that this will be an interesting presentation and also a very interactive one, because we know in Barbados there are some, I shouldn't say there are some who strongly believe in the herbal component. So they will tell you, take this and take that and take the next thing. Why you ain't try this? Why you ain't try that? So that there's always that question in terms of the herbal component and the other component. So let's welcome Dr. Nimrod.
Okay, so pleasant good afternoon, everyone. Thank you for the opportunity to come and speak to you about a topic that has been of interest for probably the past 10 years for me. So we get straight to it. Right, so we're looking at herbal remedies and supplements, cures or complications, and we're trying to focus on what we refer to as evidence-based insights with respect to some of the treatments, right? So it means that they would have done studies at different institutions and had enough persons to hopefully give us a recommendation. So this is something that is true. More and more countries are actually looking into herbal medications. I think when I was here last time, we spoke about Eastern medicine and Ayurvedic medicine, and that's still very much a big thing actually going forward. So we know that globally, the use of herbal remedies is pretty much on the rise, especially when it comes to cancer. So over 80% of persons in developing countries, which include ours in the Caribbean, actually depend or rely on traditional medicine, right? Whether it's for cultural purposes, it's a hand-me-down thing, but they look to it. It might be, something, again, they would choose over chemotherapy or chemical, right? 33% of cancer patients in the US use complementary and alternative therapies, right? And this is from the National Cancer Institute. And if you can see my global map, all those beautiful green areas. So you see in Australia, we could see, down to the South Africa, we could see India, all those other areas are very much into it. And maybe if we look in the Caribbean, might see just one island a little higher up, right? But this was actually since 2001. So I'd like to think that map is probably a lot greener than that. They say go green, and the benefits of, we go green, right? So let's see if we can come up with the definitions, right? So we normally say herbal remedies. So we're looking at plant-based products. So people who cook with turmeric. Okay, good, right? There's ginseng, there's garlic, all right? Garlic for high blood pressure too, right? Yeah, it does. It works in terms of vasodilation. My medical students, that's a question every how many weeks. And then we're looking at things like supplements, and patients have a way of finding out everything before I do when it gets to a supplement. And then I have to be sitting on the back of the bottle, and I'm like, let's see if we Google this today. But again, supplements can include vitamins, minerals, and other bioactive compounds, okay? So when they're actually selecting, we can select based on different categories. So most persons want to use immune boosters, because when you start treatment, or even if you're looking at the preventative side of it, the immune system is pretty much the organ system that keeps your defense system going. So we want to build it up. So you've heard about echinacea, and these are the things when you have the flu. Sound familiar? Right, so persons want to try immune boosters. And then some might be anti-inflammatory agents. So if you've got that little arthritic pain, or you have a pain anywhere, they may choose to use a herbal-based or maybe a supplement, I call no names, like Omega XL, to see if we could get rid of the joint pain, okay? And then we have antioxidants as some of the other groupings or classifications. So let's look to see, for example, we're looking at turmeric, right? And it shows promise, it says, with respect to cancer prevention, because it's been already classified for its anti-inflammatory properties. And this was actually based on a study done by Agarwal et al., and this is in 2011, which highlighted the potential. So if you're looking at my very interesting arrows on the diagram. It shows the inhibitory effect of turmeric or curcumin on arachidonic pathways. So to simplify it, when we actually get a pain response, which is kind of what that diagram is speaking to, we have COX inhibitors, COX-1 and COX-2. COX-1 will help to protect the tummy, right? That's kind of like where we take omeprazole. So we have COX-1, and then 2 is for pain mediation, right? So taking the turmeric, actually, as you can see with the X, it blocks going to the next active ingredient in terms of producing a prostaglandins. So it gets an anti-inflammatory, even a pain relief sort of effect from using the turmeric, okay? The same thing on the LOX pathway, right, in terms of breaking it down, because all of this has to do with pain, and this is actually sourced from a curry spice study. So those who love curry as much as I do, you can get it. But it helps, supposedly from his study in 2011, to have an anti-inflammatory and also protective benefit from using the turmeric. And then green tea. Persons will ask me during treatment, can I have green tea? Green tea is used for what in particular in Barbados? Gas, yeah, that works too. What else? Which one? Weight loss, yes. Most people use green tea for weight loss, okay? So it says that epidemiological studies suggest it also has protective effects against breast, prostate, and lung cancer. And Zhu et al. And his team in 2016 would have actually done a study that would have compared the effect of green tea in persons who were at risk for developing these types of cancers, okay? However, as much as we love the herbal remedies, we do have challenges with it, right? So many studies are either preclinical, which means we haven't gotten to assessing, like mass in terms of numbers or putting them into 2 groups for comparison, and it has limited possibilities for extrapolation. So most of these at times will be based on anecdotal reports in the first instance, and for those that would have done limited studies in the past and their sample size and the results that they would have gotten, we would apply that to said patient, okay? So again, most of my colleagues, and Doc could probably agree, and the doctors in the room, subscribe to evidence-based medicine, correct? I'm watching somebody with his arms folded. Hi, Doc. Yeah, okay, so evidence-based treatment, but again, cancer in its entirety is actually more along my specialty in public health, which is mind, body, and spirit. So it includes and encompasses all aspects of a patient's journey. Is that correct, guys? Okay, at least for the patient advocates, I can speak to that. Okay, so herbal remedies, we're looking at, well, we don't use mistletoe, right? But it was actually a study done in 2001 in Europe where they used it as adjunctive therapy in addition to patients who were actually having treatments for cancer. And it showed just limited improvement in patient outcomes in terms of improving the overall outcome or survival for the patients. But again, we say limited because most of these studies do not give us the full potential. The ones that we spoke to, and that's probably more common in the Caribbean, would be, as we said, the turmeric, showing positive effects, but there's low bioavailability. So even though it works, how long does it stay in your bloodstream for it to have a duration? So if we give you, for example, Alfen, or diclofenac, we can say take the medication every 12 hours. Why can we say that? Right, good. So we have evidence based on the concentration coming out of the studies, the duration, the efficacy, the time to the onset of, the relief. All of those are actually documented. But with plants, I can't tell you how much. So that's always a challenge, right? So let me look at, for example, graviola. Anybody knows about soursop and supposedly right. So I had a patient who was a low-grade lymphoma, and then he just switched, and it became a high-grade lymphoma, and it went from like about 1 centimeter to 5 centimeters. And his wife, who is actually a physician, started giving him graviola or soursop. He still continued on his traditional therapy, right, with monoclonal antibodies. But over time, his tumor actually shrunk. We did nothing different. He was still on his same therapy, but it shrunk from 5 centimeters down to 0.5. Okay, with the gravula. And I refer to it again as a case-by-case scenario when you're treating your patients. What works for one may not necessarily work for all, but we gave him the opportunity to continue because I couldn't tell him, was it a young leaf? Was it a mature leaf? How many leaves you have to boil? So he took it upon himself to try to find, a medium-sized one. He took 3 leaves, he blanched it for breakfast and for dinner, and it did have a response, right? So for example, the benefits of graviola or soursop will be that the fruit itself has vitamin C, right? It's good for vitamin C. It's also anti-inflammatory, has some antioxidant properties. So in that case, if you're talking about having maybe a balanced diet in that regard, then once there's no contraindication to the medications we're giving you, which was his antibodies, then I have no objections to giving my patient, okay? Right, so the thing that we have to be very careful, though, is potential interactions when we have our patients on chemotherapy and radiation therapy, right? It wasn't immunotherapy. So let's look at some of the benefits. So we're looking at supplements now, and a lot of us probably subscribe to it if we don't get it in our diet. And diet and nutrition is the hallmark and the cornerstone of cancer care, right? I can't emphasize that enough. If you're not eating properly, you're going to have challenges. You may actually have decreased appetite. You might have a mucositis depending on the treatment you're on. Your mouth becomes really dry or painful. I get a chillosis at the angle. There are different reasons why, and especially after the first week of chemo, when you're nadir and your blood cells plummet, blip, okay, you need to drink. If you can't eat, you need to put something in, right? So again, it's very important to get it in because food is the building block for healing, isn't it? Right, so it is important. So what you select to put in your body is what's going to form the foundation or the building block for the body to actually repair and continue with your treatment regimen. Right, so in some cases, we're looking at supplements, we're seeing benefits versus risks. We see vitamin D. We can get vitamin D where? We live in the Caribbean. Right, we can get it from the sun, right? So 7 o'clock or 6 o'clock sun, if it's out by then, actually helps. And there was a study that actually showed improved survival in breast and colon cancers, right? This was 2006. So granted, it's dated. 5 years is normally the maximum. If there's nothing else then we subscribe to the studies that would have been until we begin another cycle in terms of the assessment, right? So sunlight is really good. We had a joke in Trinidad that sunlight kills COVID. I don't know if that joke got to Barbados. Right, there we go. Right, so again, sunlight was helping to produce the vitamin D, right, which actually was shown in subsequent studies to have an immunoprotective effect for patients who were susceptible to COVID. Then we have omega-3 fatty acids, which are anti-inflammatory, and it could help reduce cancer cachexia. Okay, so it means really bad weight loss, right? So I bit my tongue on that one. But you can use the omega-3 fatty acids. And if sometimes patients subscribe to eating fish instead, if you don't want to eat fish, then you can actually just take the capsules. Right, so we're looking at antioxidants. So antioxidants, which can include vitamin C and E, evidence suggests they can reduce chemotherapy efficacy by neutralizing free radicals, okay? So if you look at my diagram, you can actually see that antioxidants prevent cell damage, and that's what most people will speak about in terms of justifying having antioxidants. It neutralizes free radical, it helps to reduce the damage that can be caused on the cell. As you can see, stress, toxins, chemicals, radiations, all of those are potential variables or factors that can cause cell damage, right? So antioxidants will prevent in that regard, but as they're saying, it may reduce chemotherapy, not in the average person who's having it, but the efficacy can be reduced. So we also have to be careful and speak to your physician to let them know what you're taking, okay? So it's okay to have vitamin C. We have enough fruits on the island. Vitamin E, you get in what? Go again. Which one? Rice? Wheat, right? Well, yeah, wheat, yeah, kind of, but more beef for the wheat. Rice, vitamin E, you can get as well. Anybody else? Where are my dietitians in the room? Which one? Everybody talking so quiet. It's the food, it's the itis. Come, you need to wake up. Okay, where's my vitamin E located? Any other food groups? No? Okay, so you can Google that while we're speaking. That's fine. And then you have excessive vitamin A, right, which leads to an increased lung cancer risk in smokers, right? So there's something in the Caribbean. If it's good, they take a lot of it. That sounds familiar, right? So if the aloe is working, you're having 2, 3, 4 pieces of aloes for the day. So we also have to remember something called, what you call that, moderation. So a little bit is good enough. Too much of something is good for nothing, okay? So you can also have hypervitaminemia, for example. So we don't want to overdo. That's why we have things like recommended daily allowances going forward, all right? So don't overdo with respect to your vitamins and your supplements. All right, so we're just kind of going through again, right? So it's showing you the turmeric. It says that it reduces inflammation, but it requires black pepper extract for better absorption. There's ginseng, which is a root, which can reduce cancer-related fatigue in particular, but it does have some blood thinning properties, right? Like antiplatelet. So if patients are actually on blood thinners, aspirin, anything else that can actually cause you to be at risk for developing a bleed, you have to be careful with respect to the ginseng. Garlic is antioxidant, but it also has antiplatelet properties as well, okay? So depending, again, on concentration, frequency, things like that, you want to let your doctor know that you're having it, but you're not overdoing it, okay? So it's good to have these things in a balanced diet, but not to take it off the extreme end. So these are common herbal remedies and their impact, right? Just a few extra. We spoke about turmeric, green tea, ginseng, boosts the immune system, helps with fatigue. There's garlic, mistletoe, which I said. St. John's wort is a popular one in the Caribbean. Men, let me hear you. What do you use St. John's wort for? Which one? Somebody said brush your teeth? What was that? For real? That's true? Okay, you see, I learned something new today. Okay, right, St. John's wort, definitely. Again, sometimes for prostate, we use it in the Caribbean. But again, we can see from known risk of complications, St. John's wort can reduce the effectiveness of chemotherapy drugs, such as irinotecan, right? So that's going to be one of my case studies coming up shortly. And it can also interact with other medications, like SSRIs for persons who may be suffering from depression or mental health, and then women who want birth control, okay? And it also has claimed anti-inflammatory effects, but it also has antiplatelet effects. So I had a patient come in, and patient was already on Clexane, right? Colon cancer, on Avastin, which can increase the risk of hemorrhage. And then we were going good for chemotherapy all the time, you know, and then patient's like, oh, I have blood in my urine, because you're supposed to dip it and look for protein and blood in the urine. And you know, you ask the question, are you taking anything new? Nope. I said, you sure you're not taking anything new? I was like, anything different? Are you taking a tablet? Nope. I said, okay, no problem, that's fine. So we probably get like 10 minutes into the interview. I said, are you drinking anything you're not supposed to? And he goes like, well, doc, you know, my wife gave me this thing to drink for breakfast. I'm like, Lord, okay, here we go. And then you sit down and you go through it and you check with the drug interaction, check online, and you're like, that's what it is. So it wasn't the Avastin, it wasn't anything else he was on before. He just added a new component to his diet. Good. All right, so we know ginger, especially for women. So it helps anti-inflammatory heartburn, nausea, vomiting. Milk thistle, I have no idea what that is, but it says, wait, that is, what that's doing? Stinging nettle, thank you very much. All right, so stinging nettle can interfere with estrogen-sensitive cancers, right? Because you can actually get estrogen from the stinging nettle itself. Yeah, you can blanch it, and you will get plant-based version of estrogen in the stinging nettle. Right, so regulation and safety concerns. So the thing about it, as much as this is definitely going to be a hot topic forever, because this is cultural and it's in the Caribbean, we still lack standardization to some degree, right? Doctors don't like to touch into anything herbal and other with a long stick, because we can't justify the side effects. There's no standardization, and it's not regulated to the same way like pharmaceuticals. So if I tell you to go and take this tablet today, let's say for high blood pressure, I put you on amlodipine. Side effects might be pedal edema or swelling in the ankles, for example, right? Or sometimes you might get a headache. So we know, based on the studies, what to expect going forward, but we really can't speak to very much for herbal unless we're actually checking it from a validated source, right? And then we have FDA warning approval. Sometimes they're unlisted components inside of the medications themselves, right? Inside the supplements, which they will not disclose to you. So we also need to be careful there so that it doesn't cause any adverse reactions. All right, so just 2 studies quickly as we go along. Right, so case 1 was actually liver toxicity after using something called kava supplement in a colon cancer patient, right? So this particular herb or supplement is a popular one used for anxiety and relaxation, right? It gives you a sedative effect, but there is a known association for hepatotoxicity or liver damage. Right, so the patient started developing symptoms of liver toxicity like jaundice and pruritus, etc., itching. And then we found out that the patient was taking supplements, right, alongside the cancer treatment. So if you did the blood test, you would see that the liver enzymes would be elevated because, again, that is one of the side effects. And then there were symptoms indicative of liver damage, right? So by the time we ultrasound, or even clinically, patient had these untoward side effects. So discontinuation of the supplement actually resulted in gradual improvements in the liver function, because once you take away the offending agent, then ta-da, we go back to baseline. And then we know there's a strong relationship between kava and liver toxicity, right? So we want patients to be very cautious when using supplements, especially those that have known adverse events, for example, okay? Right, so implications for practice, all healthcare providers should inquire about herbal supplements in our cancer patients, and if it's there, provide clear guidance. So takeaway is that this particular supplement causes liver damage, which means that we need to be very vigilant and to build relationships and rapports with our patients. If patients actually feel that they may be victimized or they may be in any way have that bond with the physician affected, patients are not going to feel free to come and speak to you, correct? And that's the example, even for my patients. It's always good to have a heart-to-heart, as much as your evidence-based training tells you to think other. Sometimes just the empathy and listening opens up so much more that they are willing to trust you and let you know what else is going on, as opposed to being chastised or spoken down to. Oh, you shouldn't be using that. That's not good for you. That's not the way we do medicine, okay? That's not the way we do medicine. We try to listen to the patients because they are our primary contact, or they become family or friends. In my case, that's how I feel about my patients, okay? And I think that should be the general train of thought for physicians on the whole. Right, last case, St. John's wort and chemotherapy. This was in a case where the patient was on irinotecan, right, for colon cancer, combined with St. John's wort. This was et al. In 2002, I'm not going to bite my tongue today, and they were looking to see the effect of it, right, on the efficiency of the irinotecan, which is a chemotherapy, well, not chemotherapy, targeted therapy drug, technically, right? So irinotecan is metabolized by the liver enzyme, and St. John's wort is known to induce that, right, potentially altering drug metabolism or the concentration, right, that's in the patient bloodstream. So the study was conducted on patients receiving irinotecan alongside with the chemotherapy. We gave them St. John's wort, and it decreased the plasma levels of the irinotecan, which is going to be the therapeutic agent for this particular cancer, right? And it led to decreased anti-cancer efficacy, because when we treat patients, we normally do your height and weight, right? Because we want to do your body surface area to do your dosing, right? So in this case, after we've done that, if you're taking something else that affects a particular liver enzyme, it can speed it up in terms of metabolism, so there'll be less of the desired concentration in the bloodstream, right, to target in relation to what we would have calculated from the beginning. So pretty much conclusion is the same, right? We need to know what you're taking, advise against supplements that would affect the efficacy of the evidence-based treatment, and the importance of having that this is what it looks like, discussion with patients, right? That's the St. John's wort. Right, so patient perspective and decision making. Patients turn to herbal remedies for cultural beliefs, fear of conventional treatment side effects. I don't want to lose my hair. I don't want to be sick. I don't want diarrhea. I don't want whatever. All right, and the desire for natural alternatives, correct? I've heard patients rationalize, well, we extract the chemotherapy from plants. I'm like, you did a lot of homework, right? So yes, but I can't tell you the concentration, right? But again, no harm in finding out what the drugs do with the traditional remedies, if that's the case, okay? So our role as clinicians is to have that open discussion with the patients, right? And we need to prevent complications, good? So things that stand out there, I'm sure we've seen most of it, the aloes, the blackberry, the cayenne pepper, that's another hot topic, particular for prostate cancer, but you can use it as a pain reliever. So people will traditionally subscribe to ancient remedies. Good. Anything else again? Right, so best practice, assess your patient use, educate, check for interactions. Always have a balanced approach. I believe we need more research on this. And we should be guided by evidence, ideally, and integrate it into cancer care. And at the end of the day, regulate and see how best we always have our patient's outcome in front. Okay, so thank you for your attention. Questions or comments? Yes. Good afternoon.
I had 3 quick points.
Sure.
Renee Boyce, I completely agree with the need for that patient-doctor consultation. Traditionally we are taught past medical history, present a complaint, past medical history, past surgical history, drug history, and sometimes you tend to skim over the drug history because you want to finish the consultation and so on. True. But definitely in there, that's where the opportunity stands for us to figure out what they're taking. And I completely agree with the non-judgmental approach, because patients aren't going to tell you anything if they feel as though you are sitting down up here and they're down here, whether or not they're more knowledgeable about a particular subject as compared to us.
True.
The second thing I wanted to talk about would be like the school curriculum. Perhaps as part of our medical training, this should be a standard approach to learning as part of pharmacology, that this should be something that the medical students are taught. I'm not aware of what the current curriculum is. I graduated quite a few years ago.
Not there yet.
Right, so that's another thing, and you put it up briefly on your slide, but one of the things that we have in our region is a paucity of research. This presents such an opportunity for us as physicians in the region to be thought leaders and world changers. We have all of them out there in the backyard, and pick a few leaves and do some research. Obviously in the structured way, but it really does present a good opportunity for us. And we're talking about the various types of tourism, medical tourism. So these are just some opportunities that we can think about. Thank you very much.
Oh, good. Thank you very much for your comments.
Thank you very much, Dr. Nimrod, for an excellent presentation. I am concerned with regard to turmeric. I had a patient who was using a lot of turmeric supplements and came at a point where when I checked her liver function, it was really elevated. It has been over 5 years and we have not been able, even having stopped her from the turmeric and stopped her from using it in her cooking, her liver function has not returned to normal. And during research, there are studies that show that there's liver-induced damage, there's turmeric-induced damage for the liver. A 2023 study in the US showed that there were at least 10 cases, of which 5 were hospitalized and 1 died. So I know turmeric is a fad right now in Barbados, and it needs to stop. People need to let their doctors know. They need to get their livers checked. They need to stop using turmeric. It is a drug, and when you're using supplements, let your doctor know so that the interactions between the meds and the supplements can be looked at. Thank you.
Thank you very much, Doc. So that's an excellent point. So I will tell you that I go online and I look at the drug interaction checker. So if you're using like e-medicine, or I think John Hopkins has, but normally e-medicine, you can put in the traditional drugs and you can put in the herbal if it's there, and you can actually see what the interactions are and exactly which one will send up or reduce or the toxicities as well. So duly noted. Thank you.
I have a few questions.
Sure.
And one comment. My first comment is that doctors trained traditionally are not receptive to any type of herbal treatments. Or, have you studied small flower willow herb and guinea hen weed for the prostate? That's one question. Have you studied hawthorn berry compounds to strengthen the heart, especially when you have cancer, you need to be strong? And have you studied the moringa plant?
Okay, so I'm not familiar, transparent, I'm not familiar with the hawthorn. I've heard about it actually from a patient. So if you have information, no, don't disappear yet. If you have information that you want to actually enlighten the rest of us about it, would be great. Moringa is also another hot topic back in the day in Trinidad where nobody's tree was safe. Nobody's tree was safe. And patients were using it in particular when they actually had low blood counts, for example, and low platelets. To say there's any evidence-based studies coming out of that, I don't have any. Off the top of my head, I could look and my colleagues could probably respond in the room, but I don't have anything at the moment. So a lot of times we go on, so patients go on the principle of something antioxidant or something anti-inflammatory, and they will start selecting accordingly, right? And again, like I said, even soursop, if it's too much, and depending on which part of the tree it is, it can also be toxic, right? So please enlighten us. I'd like to hear.
Well, I can enlighten you about hawthorn berry and hawthorn berry compounds. You're looking at a person who have received cure, if we want to call it that, by using hawthorn berry compounds for the heart. And if you want to know about it, it has been used in Europe, especially Germany, for many, many, many years. Okay? The guinea hen weed is used in Jamaica. We call it gully root. We call it gully root here in Barbados.
You don't know what it is? Okay.
And there's a lot of research done on this small flower willow herb for the prostate.
For prostate, okay.
Right. And the moringa plant, we've had the moringa plant in Barbados from the time I was a little boy. And I know for sure that the seeds could be a little bit damaging to the liver and the kidneys. But the flowers
and the leaves
are very, very, very good for any type of ailment, strengthen the blood and stuff like that.
Got it. Thank you very, very much for your contribution. And like I said, we're happy to have those discussions, and I'm sure my colleagues will say the same. So thank you for your interest. Hopefully I come back next time. We'll have more research going as per doc. And yes, thank you for your support at the conference and having me here this year.